I think that's just really cool. Like,
it's a little chaotic, I guess. Telling me it's something they've just started it. They've said remote control unit is under remote control.
I did.
Don't think they're like straight up like fucking. They can do that. Yeah. Oh, that's good.
Like, it must be like hard. Like, I think it's really cool how like I would say like it's just like so like we're all learning it. It's not like is it on channel? Yeah, so that you my hand is around like in factory like the large you can't be down. Yeah. So it makes sense. And it's like over social media. Like why not? Yeah, that'd be better. I need to watch it. You guys should be saying that. Yeah. Let's do it quite well and years and it's so great. How are you doing it?
Kia ora koutou katoa, no mai haere mai, ki te manatu haora. Welcome back. We're now effectively doing weekly updates. And today what I can inform you of is that there are 2 new cases of COVID-19 to report in managed isolation in New Zealand, and we also have 1 historic case to report. So our total number of cases is 3 today. There are no new cases in the community. So one of the cases today arrived from Ireland via Dubai on the 29th of September. The person has been in managed isolation at the Sudima Hotel in Rotorua and tested positive after developing symptoms around day 8 of their stay. They've now been transferred to the Auckland quarantine facility. Second case from Hong Kong on the 3rd of October. The isolation at the Holiday Inn in Auckland and has been transferred to the Auckland quarantine facility on returning a positive test from their routine day 3 test. Now, that third case, which is an historic case, is regarded as an old infection where the person has not been actually infectious while in New Zealand. This person arrived from India on the 27th of August, tested negative on routine tests around day 3 and 12 while in managed isolation, and completed managed isolation on September the 11th. The person was retested as part of the follow-up to the Christchurch returnee group of cases we had and returned then a weekly positive result. We have seen these before going to treat these cases as historic cases. We'd confirm with our counterparts in India that this person had not been recorded and reported as a case there. The person hadn't been, so we have now recorded this person as a case and will report it to the World Health Organization. I should say the person was in self-isolation as a precaution anyway while that investigation was undertaken. So our total number of cases confirmed in New Zealand is now 1,508. One further case is now considered to have recovered, so our number of active cases is 39. These are all imported cases, and there are no community cases that are active at the moment, as was announced yesterday afternoon. I think that's a great milestone. We have one person who remains on the ward in Middlemore Hospital with COVID-19 today. So with those numbers I've just reported, and as Auckland has now joined the rest of New Zealand at alert level 1 today, it's worth reflecting on our collective success once again in responding to an outbreak, the Auckland August outbreak. And it is a very good time to remind all New Zealanders arose. There is an ongoing risk, so we need to stay alert and play our part. Any future cases we need to identify quickly. We need to get people into self-isolation and find close contacts, something we have done once again successfully, get these people tested and avoid the virus spreading unimpeded in our communities. The way to do this is simple. Most importantly, if you are unwell, stay home and seek advice and get a test. Please continue to keep a record, and there's an easy way to do that with the NZ COVID Tracer app on your phone. Please keep using it. We have seen a drop-off in people scanning. Businesses are still required to display the QR code. We have and will continue to remind them of that obligation, and we're asking them to make sure the code is prominent so it is easy for people to continue to scan. The use of that information was very much an important part of our response to the Auckland August cluster, and in particular the cases that travelled to Taupō and then resulted in an additional little group of cases that we followed up. I do want to continue to encourage people to use masks wherever you are on public transport and on flights. It's not compulsory, but I would recommend it, and I will be doing so myself. Please maintain physical distancing where appropriate and where possible, and of course keep going on the stringent hygiene measures, including washing your hands and of course good cough and sneeze etiquette. We all have a role to play, as we do in managing the outbreak. We have a role to play in preventing the next one, so please do play your part. We have done well to date by acting together. We will continue to do well if we all continue to act together.